Welcome to this episode of the Good Grief Believer podcast. I am your host, Julie Craig, and I am excited to be here today with Dr. Clay Brigance, who is a PhD and a licensed professional counselor, researcher, and nationally recognized specialist in couple therapy for infertility and reproductive grief. He's the founder and clinical director of Shiloh Counseling, which is a group practice that specializes in relationship therapy for couples navigating infertility, miscarriage, and perinatal loss. And he's also the host of his own podcast called Love and Infertility. So, Dr. Brigance, it is really exciting to have you come and share your expertise because your clinical and research work has included more than 1,000 individuals and couples who experience infertility and miscarriage. And I know this puts a huge strain on relationships and it can compound grief. And so I'm really happy that we are going to be talking about this particular aspect of grief that doesn't have as good of a platform, right? When your husband passes away or your daughter, dies, there's a huge amount of sympathy and support that comes. But what happens with couples who experience infertility? They just kind of suffer in silence a lot, don't they?
Right. Oh, yeah, absolutely. Absolutely, Julie. And yeah, Julie, thanks so much for having me. I was so eager when I got your message about being on the show, and I think you're doing fantastic work. And I think that the work that you're doing and the conversation that we can have today can maybe illuminate a little bit about what couples and individuals are experiencing when it comes to infertility, when it comes to miscarriage, any type of reproductive grief, where we have this vision of parenthood, that how we think it should happen for us, and it becomes totally disrupted. And like one of my good friends, Jenny Lupka, she's a counselor, she's a colleague of mine. She says it's the kind of grief that you really don't have a Hallmark card for,
That's right.
Yeah. So it's what we call a disenfranchised grief. So it's grief that is not publicly sanctioned or socially mourned. So we don't really have a funeral whenever you go through infertility, a lot of times even miscarriage. So there is still this visceral grief that we experience. And also, like you kind of alluded to, Julie, there's other griefs too. There's griefs of your maybe your intimate relationship. Like you thought that your marriage or your intimate partnership would look like this, would have a child, but now maybe it doesn't, or maybe it can't. So there's a grief of that. There's a grief for yourself of who you are as a potential mother or father. So there's all of these griefs that are happening all at once, and there's no way to like fully express the grief too, like in a social way. So it's what I have found in my work is this grief it can be especially hard because of that,
Well, and what I find so compelling is your backstory and what has brought you to truly be someone who can walk this walk with others as you are counseling with them. So can you just do a little bio about yourself and your background and how you came to end up doing this kind of work?
Yeah. Oh, yeah, absolutely. I get that a lot, Julie, of like, why is this dude specializing in mental health and infertility and couples work? And for a lot of us that specialize in this as mental health professionals, we've gone through it ourselves. And our infertility journey started in 2017. And I think I mentioned this on the call with you, Julia, and we called prior to recording.
Yeah.
And everything about my life up until 2017 was about becoming a dad. I desperately wanted to become a dad and a husband. And I thought that, that's what it took to be a man. to be a man enough, you had to be a good husband and a great dad. And a great dad means somebody that financially provides, but is also emotionally present. And so, that's why I went into school psychology, so I was a school psychologist for 10 years, Julie,
Wow.
where I did testing here in St. Louis for kids who have disabilities in the schools. And it was a great job. I loved it, but it was like a square peg in a round hole. And I chose that profession because I wanted summers off. I wanted something predictable
Uh-huh.
so that I can be the best dad that I could be, at least in my own mind.
Uh-huh.
And
So
whenever
very intentional. I mean, we're talking
yeah,
about
yeah,
super, super intentional
yeah,
in parenthood. That,
totally. Before our kids were even here. So
yeah, I
when,
think that makes you unusual in some aspects. I think a lot of people fall into parenthood
yeah,
or assume that they will be parents, but you were
yes,
very, very intentional, which probably makes the grief, you know, even more just
yeah,
difficult.
yeah, totally. I think that, through that experience, I went from desperately wanting to become a dad and dad being a dad is my identity. And by the way, my dad is like Superman. He's,
He must be, yeah.
yeah, his cape is 15 feet long and he's a big man. He's six
Uh,
foot three. He's a construction worker. So he's, you know, so
strong.
so I thought that, that's what it meant for me to be masculine. And, I'm not like an overtly masculine dude. Like I'm 5'9", I'm 130 pounds soaking wet.
Okay.
Uh, could barely swing a hammer. I've always been a bookish, nerdy kid.
Mm-hmm.
So I thought that, well, that's one way that I could be really masculine. And so when it
Yeah.
didn't really happen for us, Julie, it was like this complete psychological, like unraveling of me, of like
Yeah.
this, who am I if I can't be a dad? Who
Right.
am I? Which, by the way, Julie, it was male factor infertility. So it was because of me
Oh,
that we
wow.
couldn't have children naturally. So, there was all kinds of shame and guilt around that and
And
grief.
even more,
And
am I not a man because I
right,
can't father a child? Yeah.
right, 100%. And that's actually, I don't know if this resonates for your listeners, Julie, but virility is actually, there's a big connection between that and perceived masculinity for guys. So
Mm-hmm. For sure.
this, ability um, to produce a child, to get your wife pregnant, all of that.
Mm-hmm.
So when we went through that, we eventually went through IVF, which is in vitro fertilization. So that's when they essentially take one of my sperm, one of my wife's eggs, and they put them in a petri dish and like force them to like come together. And our boys were grown in a lab in Illinois, which is wild. Um,
Wow.
and we did a transfer. I'm skipping so much, Julie, by the
No,
way.
it's
I'm moving
okay.
fast. But we did a transfer. We had our boys, Jonah and Isaac. But through that experience, Julie, it was like this, and I'm sure we're going to talk a lot about faith, but I felt God really called me to say, this is something that you can carry forward to other people. But by the way, you're not going to do it in the schools. You're going to do it through your research. You're going to do it through the heart and the mind that I gave you, that the Lord gave me. So, so I started pursuing a PhD in counseling in 2019, and incredible that my wife was so supportive of that. When I told her, I said, "Sweetheart, I need to get a PhD in counseling," and she was like, "Go
And it's
for it,
going to
do it."
take 7 years.
Yeah, yeah. She was like, "Go for it." So I graduated in 2023, and so
Oh, even faster.
so got through it, and I loved it. I loved writing. I loved learning. I loved growing in myself as a human and clinically. And so my specialties since then has been research and also practice of how can we help folks going through the infertility journey. Specifically, Julie, how can we help couples keep their relationship thriving in the midst of all of it, because 25% of couples going through infertility and miscarriage, Julie, actually find that their relationship is stronger after it. But
Oh,
but
wow.
30% get divorced or separate because of the infertility or miscarriage, not because of other factors. Which,
Wow.
by the way, it doesn't matter if you have a child or not. Those factors are pulled out of those
That's
stats.
so
So
interesting.
yeah, so I was like, when I read that stat, Julie, I was like, I am not going to stop until that 25% becomes 100. I want every couple going through this to know that their relationship doesn't have to be a casualty of their grief, of their sorrow, which, by the way, their grief and sorrow needs to be seen and heard, because all of us as humans deserve our emotions to be seen and heard and cared for. And it doesn't have to rip you apart in this beautiful relationship that you have found. So that's been my work, and I'm really excited. My first book is coming out
Oh,
Q1 2027.
okay.
So it's published by the American Psychological Association. It's couple therapy for reproductive grief. So it's going to be like the
It's a
kind of go-to.
textbook.
Kinda, yeah. Yeah, it's going to be like a guidebook. So not
That's
quite a textbook,
wonderful.
but pretty close. Yeah. Yeah, it's been a bear
That's
writing a bit, but it's been a lot of fun. But,
I wonder
yeah.
how much these same principles could also apply to couples who've lost a postnatal child, because I
Yes.
think the
Yes.
statistics are also very, very poor for
Yes.
couples who've lost a child after a live birth.
Yes.
Um, they probably go through some similar struggles.
Yeah. I bet you're 100% right, Julie. I bet you're 100% right. It's
Wow.
all the grief experience and how we navigate grief and care for each other in the midst of that. Yeah.
So, so you have talked about reproductive trauma as an ultimate relationship stress test.
Yeah. Yep.
So,
Yep.
what is it about infertility and pregnancy loss that places such unique pressure on a couple's connection?
Oh my gosh. How much time do we have, Julie? Yeah.
Oh, we can go on and on. We can make a part two.
Oh my gosh. There's so much. There's so much. I can remember, my wife and I, our marriage just being on the rocks because of how we had two very different ways of navigating this grief. Um, and because we didn't have the skills to know how to communicate those very different experiences and hold them gently, I
Mm,
always say that when we're communicating about our reproductive trauma and our reproductive grief, which, by the way, are very subtly different,
okay.
um, but when we are communicating either one of those, reproductive trauma, reproductive grief, it's like holding wet soap. A lot of times what we want to do is we want to try to grab it with
Uh
our
huh.
with our spouse. So like we want to fix it. We
Yes.
want to rescue them out of their emotions. This is especially true for dudes. We as
Yeah.
guys, we want to rescue our wives out of those emotions. And so we start to say like, just be positive, or like, relax, it'll happen, or like all these things that make her feel like she's going crazy, because she's like, am I the only one
Who's bothered by all of this?
bothered by
Yeah.
this? Right.
Yeah.
But what we have to do is hold that soap gently. So how we do that is we just sit with each other and validate it, and we hold it with care.
How did it look? How did the response look for you, and how did it look for your wife, and how was it different?
Yeah. So I think because of my underlying shame and guilt of that it was male factor infertility, but also that she was having to go through all of these treatments and I wasn't.
Right, the
Um,
shots and
yeah, all the shots, all of that. I did a research study with guys where I interviewed men and their experience to infertility, and what I found is this common thread, Julie, of what I call the Dobby effect.
okay.
If you've seen Harry Potter or read Harry
Uh
Potter, Dobby the elf,
huh.
he bangs his head on the dresser and says, bad Dobby,"
Yes.
Um, a lot of these men reported that after they gave a shot to their wife, they wanted to get a shot too, almost like to say like I want to experience pain with you, but I can't.
Oh,
Um, and that's especially true for male factor infertility of like if
it's
you're
a
experiencing
helpless
pain,
feeling.
yeah, it's totally helpless. So because I felt that shame and guilt, I felt anxious, and therefore I
Mm.
felt I wanted to dismiss my wife's feelings because if her feelings didn't exist, her emotions didn't exist, then my shame and guilt didn't have to be experienced or seen.
Wow.
So what I kind of think about it, Julie, is like it's like a tree. Like the roots are shame and guilt.
Mm-hmm.
The trunk is anxiety.
Mm.
And then the fruit and the leaves is like dismissiveness or anger or toxic positivity, those
Mm.
kinds of things.
Mm-hmm.
But at the root of it is the shame and guilt. So what
Wow.
I would say, Julie, is, hey, we've got more embryos. We can try again. We can, Dr. Ree, who's our fertility doctor, and by the way, she was wonderful.
Mm.
And also, my wife and I are going to interview her on our podcast soon, so it's
Oh,
really exciting.
good.
Yeah, that's coming up soon. So I'll say like, oh, Dr. Ree was really positive, uh, but she felt like what she needed, Julie, was just for her fear and her sadness to just be seen and cared for. She needed
Yeah.
me to hold the wits,
Yes.
you know?
To hold
Uh,
her.
yeah, yes, Julie. Yes, 100%. Just to hold her
Right.
in the midst
Right.
of that.
Don't
So,
fix anything. Don't try to make it better. Just hold me and sit in the sadness with me.
yes,
But when you're sitting in the sadness with her, you're sitting in your own grief and shame. And that's so
yes.
uncomfortable.
Yeah.
Oh,
What I learned,
wow.
Julie, is that I had to be, I'm going to say a phrase that if it rattles your audience, I please forgive me if you're listening to this, but I had to learn to be man enough to tell her that I was feeling shame, feeling
Wow.
guilt. And so to be able for her to say, I'm so anxious about this appointment, and me to say, you know what, babe, that makes sense. I feel scared too, but also like I'm really ashamed that we're here because of me. And
Wow.
you don't have to take care of that shame. I'm just letting you know what I'm experiencing right now. Neither one
Wow.
of us have to fix it. We just have to sit with each
Right.
other. Um,
Right.
and through, um, I guess, changing those patterns, we were like, years later, we were like, why are we more in love now than we've ever been? It's because we feel more seen by each other. And, despite our shame and guilt, we feel seen and accepted by each other in a much more beautiful way. And so, all the things that I write about in my book and all the things that I do in therapy with couples is that, changing this narrative of, we have to have two different experiences on two different airplanes flying in two different directions. We can have open dialogue together about what we're experiencing and care for
Yeah.
each other in that without, like you said, Julie, without fixing it, you know?
That is, that took some work, I'm
Yeah.
guessing, right? I
Oh,
mean,
yeah.
at what point did you guys say, um, we need help? Did you seek help
Yeah.
or did you rely on your background? What happened there?
Oh my gosh. Um, oh man, there was a special prayer that came up for me, and I know we talked about this on our pre-call, Julie. First of all, I came to the end of myself, truly, and realizing that um, I really wanted to be man enough for my wife, but also be man enough for myself, and be man
Mm-hmm.
enough for my dad and my
Mm-hmm.
mom and society in general. Um, and realizing that no matter what I try or do, I am never enough.
Mm-hmm.
I'm never enough. Um, I have been a believer since I was a preteen, and I went through a lot of faith questions in my teen years. I think a lot of us do.
Mm-hmm.
Um, but I was a youth pastor for a while. I was a youth pastor in my early 20s, and I love the Lord. Um, I fail at loving him well often, like we all do. Um, but I take my faith really seriously. And at that point, Julie, I felt like I had nothing left but my faith. Like I felt like I was white knuckling life And all I had left was a spiritual walk with Christ, with the Holy Spirit.
Mm-hmm.
And, I think actually, as I'm sitting here telling this right now, I think this is the first avenue of me telling my spiritual story as a part of this. Most of the time I'm, at secular events, but
right. You're sharing research.
you're right. Exactly.
Right.
Or clinical knowledge
Right.
but yeah, my first step in kind of this rebuilding of clay was recognizing that I've got nothing but my relationship with God at the end of the day. I started fasting and praying more. And so that was step number one. And I think God transformed me through just recognizing that I've got nothing to hide here and I have nothing left this veneer that I've put up needs to come down. And so that was step number one. Step number two, we did go to couple therapy. Not entirely beneficial. We loved our couple therapist, but she didn't really have an idea of what reproductive grief was, of IVF, and all those things. So we found ourselves having to educate her sometimes, which is hard.
Right, because it's not a transferable experience.
Exactly. So, but we did learn a few skills there, and also too. We really sat down and were intentional about making our marriage a priority. And, I always tell couples that come to me for couple therapy, Julie, that, no marriage becomes divided or distant on purpose unless you're a psychopath. It's like the boiling frog. It's like it just happens over time with small things over time. And eventually you find yourself on either side of the Grand Canyon and you think, I am lonely in this relationship. Good relationships happen on purpose. And so we had these calibrating conversations of what our experience was and all of that. But my prayer through this time, like I mentioned to you before, Julie, was Jesus, Son of David, have mercy on me. And this was the prayer of the blind in the Gospels. And for whatever reason, during this time, my eyes just kind of fell on this story in the gospel, and it just resonated with me so much because he was crying out just unashamedly. This blind man had no more veneer. He was calling out to Jesus. He was declaring that he is the Son of David. Is another way of saying Son of God. And just have mercy on me. And then Jesus's disciples were like, dude, shut up. Like, be quiet. Like,
you're embarrassing.
You're embarrassing us. Like, and that's how I felt. I had so many people give me well-meaning advice. Like, oh, have you tried relaxing during sex? Or like, it's not about adoption, all well-meaning and loving. However, what it felt like was, dude, shut up. Like your grief have a place here. That's what it felt like. That was my lived experience, I guess. And so I could resonate with the blind man as he cried out more, Jesus, Son of David, have mercy on me. And how Jesus responded to him, not by coming up and giving him advice or rescuing him from his emotions, but asking him a question. Do you want to get well? And just sitting next to him and being present with him. Of course, obviously, the man was healed. It was a miracle. But it was the humble presence piece. That was really moving for me. So I have found, Julie, that for me, a lot of healing has come from recognizing that his presence is with me, but also there are other people in my life who can have that simple presence with me. Friends, my wife, some family members, my brothers, an incredible example.
Do you find, are you and your wife, were you be on the same page through the spiritual journey, or did you go at different paces?
We went in different paces, where, my wife started journaling a lot more, which was beautiful to see. She had more anger with God, which is understandable. God, which by the way, God can take her anger.
Exactly.
You know,
Yes, he can hold it.
he literally sang a song and created the universe. I think he can like hold our anger, you know.
Yes.
So my wife was angry with God, and also she became closer with him because it was an expression of her lived experience that I think God could just hold and be with her.
Yeah.
And and also too, we had some really cool spiritual experiences together. You know, there were some times where we were, you know,
You
distant,
were attuned. Yeah.
but there are also times where we were in tune.
Mm.
You know, there's one really beautiful example, Julie, where we were going to have an ultrasound to see if Jonah was still in the womb. We didn't know. We thought we were having a miscarriage, and Marjorie said, my wife, she said, "Can you pray over me? Pray over us." And so I did, and I led her through a mindful prayer. So I invited her to close her eyes and picture a peaceful place and picture Jesus. I can't talk about it without crying, but
That's okay.
but picturing God, Christ walking with her, and inviting him to speak to her. And so we just sat in silence and both of our eyes closed together. And when she opened her eyes, I said, "Babe, what did he say?" And she said, "I have no idea." She said, "But we were by the ocean, and I felt like it's going to be okay.
Wow.
That Jesus is there holding my hand, and it's going to be okay."
That's
So
so powerful.
we got to the fertility clinic. We're going to do the ultrasound, and they said, "By the way, we hope you don't mind, but our typical like noise canceling is like a shot, you know, to keep privacy, you
Yeah.
know, so people don't hear conversations in exam rooms. So we hope you don't mind. We've got ocean waves going." So yeah, it was like,
Wow.
and yeah, it was beautiful.
Oh.
And we had lots more scares after that. We had so many scares of, that's not me to say like, "Oh, and Jonah was fine and it was
Right,
okay."
right, right. But
Um,
in that moment, you had a little love note from God
yes,
that
yes. The
He was
most,
holding you.
yeah. The most important thing, and we try to, I think when we go through infertility, we try to read the tea leaves. We want to
Mm-hmm.
know the
Oh,
outcome because that helps us to feel safe, you know, of course.
yes.
Um, but God gives us comfort. He may not tell us the outcome, but he gives us that comfort.
Uh, Thank you for sharing all of that. Thank you for sharing the part of your faith journey. Um, it's it's such an important tool that you can
Mm,
have in your arsenal besides the counseling and the research and all of that is so good. It's so
yeah.
powerful, but you can create such a sure foundation in in having belief that Christ is aware and
Mm,
that that he has walked all of these feelings, he's experienced all of those things that you're thinking and feeling and experiencing, and yet comes and says
mm,
to have peace in him.
right.
It's but but those moments can be grounding and anchoring, but also kind of fleeting,
Oh,
right?
totally.
Because then the next day
Mm,
some of the thoughts come up again. And so how do you counsel individuals and couples when they are in the middle of this kind of
mm,
grief? what
mm,
what
mm.
what things do you advise them?
Yeah. So, um, gosh, the biggest thing is just first of all recognizing, Julie, that um, we are not ourselves when we're going through reproductive grief and reproductive trauma, and so we shouldn't expect ourselves to be operating in the same way. You know, I think a lot of individuals and couples expect themselves to just go to work and keep doing life. And um, my first affirmation that I like to give folks is to say it's okay to slow down and grieve and recognize that um, recognize that maybe you're not going to be able to go to that birthday party, or maybe your performance
Mhm.
at work is not going to be what you would want it to be. Obviously we have to have like a basic level of functioning.
Right.
But maybe there's some new ways of interacting with the world that allows us to accept the fact that we're grieving while grieving well. And by grieving well, I mean grieving healthy. So there's definitely, there's no right and wrong way to grieve, but there's a healthy and an unhealthy way to grieve.
Mhm.
Treating it like a light switch where we can feel like we can turn it on and off is an unhealthy way. But whenever we treat it like a dimmer switch of like, wow, I'm really feeling the grief a lot today. Like I'm feeling so scared that I'm never going to be a parent. I'm
Right.
feeling so scared that this transfer is not going to work. I'm feeling so scared that I'm never going to meet this little baby. And what's happening when that fear takes over, our fight or flight response starts to go off. And so cortisol is going through our body and adrenaline's going through our body. And we're just not going to be able to function in the same way. And it's really like riding the wave. Another metaphor that I like to use is, grief, anxiety, and sadness amidst the grief can be like an unwanted guest.
Mhm.
You ever have, Julie, you ever have somebody come over to your home and like stay a little bit longer?
Yes, you can't. Yes, you can't.
Right,
You keep standing up and
right,
walking
right,
towards the door.
right. Well, here we go. So that was a great party, but you should be getting to
Yeah.
bed. Shouldn't you leave? But like,
Yeah.
it's like an unwanted guest. And
Yeah.
also too, you don't just, even though the person's staying and they haven't left yet, you don't just go about your business. You do things a little bit differently. You're still recognizing that the guest is there, and um, you're still interacting with the guest. So we have to recognize that we're kind of living in a different mode. Uh,
Mm.
and
Which is a grief, right? If some,
yeah,
you
totally.
exactly, if somebody passes away, there's this automatic recognition. Oh, this person's going to be. They're going to be slowing
Mm,
down. They're not going to be out as much. They're going to be in a different state for a while. But you mentioned before this kind of grief is, what did you call it?
disenfranchised. Yeah.
Disenfranchised grief.
Mm, mm-hmm.
Yeah.
Yeah.
How, here's a scenario. You have a woman who is genuinely happy that her friends are all getting pregnant. They're
Mm,
friends. She loves them. She wants what's good
mm,
for them. But she's had 5 miscarriages.
mm.
What does she do when it's time to have a baby shower for
Yeah.
all these other friends? You
Yeah.
know?
It's never a one size fits all. It's always an exploration, a conversation. And, but I, reproductive grief, man, if that doesn't bring out all the complicated emotions, what does?
Mm-hmm.
Because there is this joy for our friends and this overwhelming sorrow that that's not us.
Mm-hmm.
You know? So what's important is to recognize that we never feel one emotion at a time. We're always feeling at least 7 or 8 different emotions at a time. One can be just really loud, and so it feels like it's the only one.
Okay.
So what I do is I use this metaphor, Julie, of you, Julie. Let's just use you as an example. If that's okay.
Yeah.
So
Yeah.
usually you are the CEO of your life. You are the boss. You are the decision maker. You decide your consciousness, your spirit. We're Christians. We'll
Mm-hmm.
say your spirit.
Yes.
You get to decide what Julie does or says, the kind of decisions that you make, major life decisions, minor life decisions. So you are at the head of the meeting table, right?
Mm-hmm.
But your emotions are your counsel. They're like
Okay.
sitting all around you, and they're telling you how you should run Julie, you know?
It's like that
And
movie Inside Out. That's what
totally. Yeah, totally. And maybe subconsciously that's where I got that metaphor from, because like a lot of people are like, oh yeah, that's like Inside Out. Totally. That makes sense. So I'm a business owner. I own, two different businesses. I have a property business and also our, counseling practice. And so, I consult a lot of different people on, how do we run this business, and people got a lot of opinions, Julie, and your emotions
Mm-hmm.
the same way.
Mm-hmm.
Typically your emotions don't want something bad for you. They just go about
Ah,
it in a bad way, you know?
okay.
So your anxiety, when you're sitting at the table, Julie, and your emotions all around you, your anxiety is telling you, you got to check Reddit, you got to check Facebook because you felt something weird in your stomach, and that can mean you're about to have a miscarriage. And so you got to know, you got to call the doctor, you got to call the doctor 6 times. You have to
Mm-hmm.
know. And that's what anxiety is telling you. In fact, anxiety is probably standing on the conference room table and grabbing you by the collar and screaming at you like, you got to do these things. You must, you must,
Right.
But what does that anxiety want for you? It wants you to be safe. It doesn't
Right.
want you to be disappointed. Um, sadness can be something similar or adjacent, where sadness is saying, don't get out of bed because there's no point. If you get out of bed, you're going to be disappointed.
Mm-hmm.
If you try to live your life in the midst of your grief, you're going to get hurt. You're going to get X, Y, Z.
Right.
Um,
And, and
and
and here are the examples that I can cite.
yeah,
Right.
yeah, from past experience, they're all valid.
Yeah.
And so what I start to coach my clients in, which by the way, this is called diffusion, and I would encourage your listeners to look this up. This is
Okay.
under the it's acceptance and commitment therapy. In other words, it's
Ah,
a modality of therapy where we recognize our values and the place that emotions have in our life without our emotions sitting at the CEO seat. You know,
okay. And
so
what did you call it? What?
diffusion. So,
Diffusion.
yeah,
Okay.
fusion is whenever we are feeling like the emotion is us. Like,
Oh,
whenever we feel the anxiety during reproductive grief, it's, or, going through IVF, infertility, whatever it may be, it's like sitting in the river and like the water's coming up over our eyes. But
yes.
diffusion is sitting outside the river and observing the river
Yes.
and being like, whoa, it's moving real fast today. Like it's
Right.
my
Without
anxiety.
having to be in it.
Yes. Um,
Okay.
Easier said than done. This is a hard practice that takes my clients a lot of time um, and a lot of work.
But that's not the same as dissociation.
Exactly.
I guess in
Yeah,
dissociation, you're turning your back on it. You're not even looking at the river, right?
right, right. Dissociation would be like you're still in the river and you're like trying to
Mm,
distract yourself while you're drowning.
okay.
You know,
Okay. All
that would
right.
be dissociation. But this is
Right.
more
So
like,
it's dangerous.
yeah. So diffusion is what I like to do is I like to encourage my clients to write letters to their emotions.
Oh,
There was an experience that I had last year where my anxiety was really showing up, and it was at the table and it was pounding its fist and saying, Clay, you got to do this, you got to do this. And so every morning or after my prayer time, I would write a little note to my anxiety and just say, hey, thank you so much for being there for me, for trying to keep me safe. I want to remind you, anxiety, that I am safe, that I'm okay. In the case of, and this was a very like general anxiety outside of
right,
reproductive grief.
right,
In the
right.
case of reproductive grief, let's say infertility, especially when clients are going through the 2 week wait, whenever they get the transfer and they have to wait 2 whole weeks, Julie, just to discern whether or not they're pregnant,
Yeah.
which is the most awful torture in
Yeah.
mankind. Um, but um, to be able to say like, anxiety, you want me to be a parent and you want to protect me from being disappointed. I get it. There's nothing I can do. And I have to accept that. I have to accept that there's no way I can know. Um, but I appreciate you, anxiety. Thanks. Thanks for trying to be there for me. So it's like this, when we do that, the research shows that our anxiety decreases when we travel with our anxiety
Is
instead
that
of trying
right?
to, yeah,
So
instead of trying to reduce it.
that's interesting because I'm thinking I'm trying to think of the men in my life and how many of them would be willing to actually write a letter to their emotions. Do you find any resistance from
Mm.
men to go on that kind of a journey where they have to think and talk, and
Yeah.
instead of just go hit something or fix something or
Yeah. Yeah. I think that, yeah, I don't think there's resistance. I think there's, it's just more difficult because we're told as men not to feel, or that feeling can be a weakness. Um, so it can just be really, really difficult for men at times,
Mhm.
not all men. Um,
It's just new. This
it's
is
just
new.
new. It's new. To be able to, it's a beautiful thing to be able to talk to your anxiety and say, you know what, I appreciate you. You're there for me. You're not going about it in a great way. But while you're yelling, I'm going to remodel our bathroom, and that's going to help me to feel a little bit calmer anxiety while you're yelling at me.
Yeah.
That kind of thing. I know maybe that
Yeah.
sounds silly to your listeners, and that
No,
makes
no,
sense to everyone.
no,
Uh,
I think it probably resonates with a lot of, especially a lot of guys.
yeah, yeah,
I think a lot, yeah, a lot of people deal with their grief by trying to be active and not have to think too much.
right.
But the problem with that is you turn the corner and it's there. It's always waiting for you
Yeah,
around the corner. It doesn't really go away.
right. Yeah. And that's a part of the growth. We grow around our grief. Our grief
Mhm.
doesn't shrink. We just grow around it. Um,
So here's a question for you. So having been so focused and intentional and prayerful and preparing to be the best dad you could be,
mhm.
and how blessed are you that you had such a wonderful dad as an example? I mean, that's just what a beautiful thing. I'm so glad you had that.
Yeah.
How, how did you redefine your purpose?
Mm, man, I think that a part of that was coming to the end of myself, I think. And so I had to start asking questions of like, who is Clay? Like, what am I going to do with the life that I've been given? Um, and how am I going to do it? How do I want to be remembered? All those questions that we build up through adolescence and through our 20s and 30s. And, I guess we're always kind of asking those questions of ourselves, but it felt like zero dark 30, like just like intense,
Yeah.
mm, yeah. So my purpose in life, Julie, is to glorify Christ and make him known.
Mm.
And I can do that by, we've heard the song Little Drummer Boy,
Mm-hmm.
uh,
Mm-hmm. Yeah.
and I know it maybe it sounds silly, but like I get emotional thinking about that because I think it's like my purpose is to do this research and to do good therapy and to teach other therapists and do as much work as I can to help folks through this grief. It's like me playing the best song that I can
Yes.
with what God's given me. Um, and so that's my purpose.
Yes.
In the midst of that, I still have to be a husband, and I'm now a dad to Jonah and Isaac,
Mm.
and um, they're a part of my purpose, but they're not my whole purpose. Um, yeah, there was just a lot of restructuring that had to happen.
Yeah. Wow. Well, it's wonderful that you have been able to take everything that you've learned in this journey and really have true empathy
Mm,
for these individuals and couples that you're working with.
yeah,
I'm curious if you can just share some of the highlights of the research,
yeah,
some things that we can hold on to understand.
yeah, totally, totally. What my research has shown, Julie, is that there are 4 ways of interacting that can predict whether or not couples are in that 25% or in that 30% through their reproductive grief. And
Okay.
again, just reminding your listeners that it's not whether or not you have a kiddo.
Right.
It's these 4 things. The first one is having a mindful attunement with your partner. So what attunement means is being able to slow down and recognize your spouse's internal world, or be curious about it. And the mindful piece is being able to slow down yourself and being able to be curious and non-reactive. So the research shows that whenever I pause for 3 to 5 seconds, what that does is that allows my prefrontal cortex, so it's a part of your brain's like on your forehead. I'm gesturing and I'm recognizing that your listeners can't see me. Oh, yeah, probably need to explain that. But it's what I call the very good brain. So it's the part of your brain that it's not really shared with really many other creatures. And we're the only ones that really, really use it. So when God made Adam and Eve, he said it was very good. So I call it your very good brain.
Your very good brain.
So it's a part of your brain that allows curiosity, that allows love to flourish, to empathy, those kinds of things, and to live with your values. But a lot of times what we're responding with is our amygdala, which is our lizard brain. So that's like your survival brain. Instinct, which by the way, survival is all about me. It's not about us. It's all about me and what I can get. So when you take a 3 to 5 second beat, what that does is that allows your brain to start to slow the amygdala down, and your prefrontal cortex comes online. So when my wife says, "Hey, babe, do we have to load the dishwasher that way?" And I can mindfully attune. So in other words, I can slow down, take a deep breath for 3 to 5 seconds, and then that allows me to have a curious approach, a non-reactive approach, and ask her like, "Hey, I'm noticing something here. Is this frustrating for you? Like,
right?
You just let me know. Like, I mean, what do you need?"
That's even biblical, though, right? A slow answer turns away wrath.
Yeah, 100%. 100%. Which, by the way, all these things that we find in research go back to Scripture. They truly do. I mean, it can even be found in Galatians, where Paul talks about the fruit of the Spirit.
Yes.
Peace, patience, kindness, goodness. These are things that happen slowly. They never happen quickly.
And intentionally.
That's right.
Yeah, you choose kindness. You choose patience.
Right. So we mindfully attune. The next one is we decrease our heightened conflict. Okay. So our heightened conflict is going to happen fast, and it's going to be characterized by criticism and defensiveness. Okay. But if we can slow down with, it's what I call in my book, I call them the evil twins. Okay. Reactivity and shaping a narrative. So if I am reacting quickly to you and shaping a narrative about what your intentions are.
Oh my gosh.
Right?
I'm thinking I do this.
Oh, we all do, because we're human. But the antidotes to the evil twins that I talk about in my book are non-reactivity. So we slow down 3 to 5 seconds, and curiosity. Hey, can you tell me what you're really like feeling right now? Not what you're thinking, but what you're feeling. What emotion is coming up for you right now? Right. And really respond with an emotion. Like, I'm feeling sad, or I'm feeling anxious, or I'm feeling angry, or I'm feeling alone, whatever it may be. Another part of that second piece is decisional conflict, navigating decisional conflict. So decisional conflict of, what do we do with leftover embryos?
These are big questions.
Yeah. How are we going to pay for treatment? Yeah. When do we stop trying? Are we going to pursue adoption or not? So couples that can navigate that decisional conflict fare better. The third pillar, which, by the way, I call these the 4 pillars of connection, and folks can find them on my website. But the third pillar is uncovering disrupted visions of parenthood. So there's an activity that I lead couples through, and I write about in my book, and it's called the Uncovering Disrupted Visions of Parenthood intervention. So it's a dialogue that couples can have about, what does parenthood mean to you? What do you hope to gain about becoming a parent? What does it feel like for you knowing that we might not become parents? Is there a deeper like history behind this that's related to your childhood in some way? You know, like all these questions where we can get at the why, the why. I always tell couples that couple therapy is about taking what the heck is that and turning it into, hey, what's that? That mindful curiosity of like, what's behind your reaction? What's behind what you're really feeling and experiencing? And then the fourth pillar is just keeping your sex life alive.
Yes.
Which, by the way, I had somebody remind me of this, a colleague, where she said after a miscarriage and after perinatal loss, it's really common for your sex drive to go way down, and maybe we need to take a break from sex, and that's fair, that's okay. But what I see a lot for couples is that the damage goes beyond like a set period of time. It can go on for months, years,
Yes.
because trying for a child becomes this mechanical thing. So this passionate thing that we had to connect now
Right.
becomes this mechanical chore.
Right.
So those four things, Julie, again, I call them the four pillars of connection. If we can do those things through our reproductive grief, then we can keep our relationship thriving.
And do you see success in your
Oh, yeah.
practice? Do you see couples who come in broken and grieving, and
Yeah.
they actually find some relief, some answers, some closeness like you and your wife were able to experience?
I see connection and closeness with these couples every single day, Julie. I
Mm.
am, there are times whenever I feel like, maybe this sounds like hyperbole, but I kind of feel like Moses, like my therapy chair is like the burning bush,
Okay.
like holy ground almost, of like
Yeah.
couples that are choosing each other, and through these skills are able to really attune to each other and feel like their grief is a part of their story, but it's not the end all be all of their story.
Yes.
You know?
Yes.
It's truly incredible.
They're not defined as infertile.
Right.
They are
Person with
loving couples who have experienced infertility.
100%. Yeah. Yeah.
That's a very different mindset.
Yeah. Yeah.
Well, and sometimes when you're right in the middle of it, you just need to know that there is hope, that somebody has walked this path and has survived it and has found meaning and purpose again in life.
Yeah. 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 There's, there's just no way around it. Infertility is terrible. Infertility, miscarriage, perinatal loss. It's terrible. It's awful. There's a big and there too. And that's not me trying to like silver line this for anybody. My wife and I grieve every day. We find that our grief is still with us all the time.
It didn't magically disappear because you were able to actually have children.
Right. 100%. 100%. It didn't magically disappear because now I'm doing all this research about it and I'm writing a book about it and we have children now. Like,
well, maybe part of that is because you start to see it. I'm relating this to my own experience, which is obviously different, but you start to see it through a different lens of, I can see other people's pain now. And I couldn't see it before. And because of that, I feel more compassionate, and I try to be more intentionally aware of others than I had been before I'd had my experience, and
oh yeah. Yeah. I am, sounds like I'm tooting my own horn, but I'm very proud of the man that I am now. I've got a lot of work to do. My wife will be the first to tell you that Clay Brigance has a lot of work to do, but on himself. But I am very proud of the man that I am now, of the growth that I've gone through in this. But a lot of my work, Julie, is recognizing that we start the reproductive grief journey in this guilt and shame usually.
Mm-hmm.
And guilt and shame, like I talked about earlier with the tree, it leads to anxiety.
Right.
Because that anxiety feeling is like, no, you don't need to be, you shouldn't be seen, because if you're found out that you're not man enough or woman enough, then you're not enough. Which, by the way, I think we talked about this over the phone. I have a theological theory with this, that, shame is the first difficult emotion mentioned in the Bible. And
yes.
And what did Adam and Eve do? I'll say we, because it's humankind.
Yes.
What did we do? We hid. We were in this space where we were naked and felt oneness with God and oneness with each other. Shame didn't exist. But now that shame exists, suddenly we're hiding.
Right. And hiding from God, our creator, you know,
and
our
hiding
Father.
And hiding from each other by putting on clothes.
Yes.
But what did God do? What did God do? A lot of times pastors, when I hear this sermon about God saying to them, who told you were naked? It's like they voice God as if he's really mad or angry, and maybe I don't want to put words.
Or can't figure it out.
Right. I don't want to put words in the Lord's mouth. I like to picture, and again, this is Clay's own just imagination here, but I like to picture God as being like, they did it. And immediately, because God is omnipresent and he's omnipotent.
He knew.
So he knew right away, my people aren't close to me. Yeah. My people now have the curse of shame. Yeah. So how do I lovingly approach somebody who's experiencing shame? I ask questions. Mm-hmm. Hey, who told you were naked? Mm-hmm. And that's what we do with each other as couples. We ask questions. Mm-hmm. Hey, where does this anger come from for you? Where does this sadness come from for you? So that helps us move from this place of shame and guilt to now this place of grief, because grief doesn't lead to anxiety. Grief leads to acceptance. And that's where I'm at. I've grieved, and now I accept the fact that there are two little boys that I'll meet in heaven one day. That our family will be complete when we come together. I think there'll be this glorious reunion. Yes. And there'd be so much that those two little boys will catch me up on in heaven. Oh,
I love that.
And I accept that I cannot tell our boys that they were made naturally. I accept that I'm a man struggling with infertility. I accept our journey, and also all of those things don't make me less than. And so with that acceptance, I can now sit outside the river and watch the river go by. And some days the river is rough and some days the river is calm. But no matter what, my acceptance leads me to just sit by the river.
And not only that, but as you watch others journey to the river, you actually have been able to be in a position now to help.
Yeah.
And so if someone wanted to connect with your work or order your book when it comes out, where is the best place to find you?
Yeah. I'm really trying hard, Julie, to be on social media. I am terrible at social media. I'm pretty sure that I was born just a really old British nerd, born and raised in Kentucky in the South, but I just feel like I need to have elbow pads, with a sweater. So I'm really bad at social media, but I'm trying. So folks can find me on Instagram. We post a lot about our podcast, but also I like to post about just practical ways that couples can connect. So that's at Dr. Dr. _Clay Brigance. You can find me on TikTok too, with the same at Dr. _Clay Brigance. Okay. And my website, if folks really want to get something out of, the research that I'm doing, I would really encourage your listeners, Julie, to go to my website. I want free resources up there. There's going to be some paid courses up there that I want them to be minimal, but there's going to be a lot of free resources up there. So it's www.drclaybrigance.com. And yeah, there's going to be some resources up there. There's also going to be ways to listen to the podcast, Love and Infertility. And to reach out through the website. You can submit a form. I'm always keen to talk to folks, even if it's not therapy, but just to connect, you know?
I hope people do,
Yeah.
especially those who are feeling a lack of hope, because because you bring such a hopeful approach,
Mm,
and I appreciate so much that you've been able to share your personal journey and how that has led you into doing some really, really significant research into this area. There's just not been a lot of study done
right.
in this area, and so it's exciting for you to give some time to this today.
Yeah.
So,
Yeah. Well, I got to say, I've been on a lot of podcasts, Julie. This is one of my favorite conversations I've had.
oh, I'm so
Yeah.
glad.
Yeah. I'm really glad that we've met, Julie. And I hope we're going to be keeping in touch and start of a friendship here. So,
I hope so too.
yeah,
Absolutely.
for sure.
Well,
Yeah.
as we close, would you just answer? This is the final question we ask all of the guests. What
Sure.
do you think it means to grieve well?
Mm. Hmm. Whoa, man. I just got chills. Like, that's a deep question, Julie. What does it mean to grieve well? I think grieving humbly means grieving well. When we can call out, Jesus, Son of David, just have mercy on me. I don't have the answers. I don't. There's nothing I can do to fix this or to change this. I just need you, whatever that looks like, Lord. Um, and there might be. I know that this is a Christian based podcast. There might be people that aren't believers that listen to this
Mhm.
podcast, and that would be cool. That'd be awesome.
Yeah, right.
Um, And if you're not a believer, if you're not at that stage of having maybe a spiritual experience like that, grieving well could mean, being that way, but with a trusted person,
Mhm.
of like feeling somebody's healing presence is a beautiful thing. I found that, if we're talking about it in an earthly sense, I felt that with my wife.
Mm.
Um, Good grief. I felt that with some guys, like,
Mhm.
just some
Yes.
John Abel, Kevin Fouch, Logan Butts, Chip Block,
Mm.
um, my brother Alan. These were all guys that would bring by barbecue and say, "Hey, we made dinner for you guys," or
Wow.
pray over us. I think, yeah. So grieve humbly and grieve in community. Um, that's it. Yeah,
Yep. I
yeah,
love that.
yeah,
Thank you so much.
yeah. Thank you, Julie. Absolutely.